For this video, we're going to identify parts of the ventricular system, interconnected network of spaces in the brain where CSF is formed and where CSF circulates. We have here left hemisected brain. Let me show you the other half. So that's your complete brain right there, hemisected. Not exactly at the midline. The section did not pass exactly at the midline because let's look at the right part here. You can see the complete septum pellucidum. It's a membrane-like structure which will separate right from left lateral ventricles. And also, if we examine the thalamus right here, again, it's not perfect, a mid-sagittal section. Now, this part belongs to the left thalamus. As you can see, if I retract, you can see the slit-like third ventricular space right there, and at the tip of the pin right there, that's the thalamic mass on the right hemisphere of this particular specimen. Also, one thing that will tell you, we're not exactly at the mid-sagittal plane. You cannot see the cavity of the fourth ventricle right here. So if we go a little more to the right, we should be able to enter the cavity of the fourth ventricle. So CSF, part of that is formed by the choroid plexus in the lateral ventricles. Then from the lateral ventricles, they will reach the third ventricular space right here via the interventricular foramen of Monroe. Foramen of Monroe, which is this opening right here. So this space here, that's already this is still part of the lateral ventricle for the left hemisphere, and you can see the interventricular foramen right there going to the third ventricle. You also have choroid plexus in the third ventricle, and additional CSF is formed, and then it is transported to the fourth ventricle via the aqueduct of Sylvius, or the cerebral aqueduct. Let me bring out another specimen here. So hemisected head. The structures have somewhat disintegrated already. There's the corpus callosum right there. We cannot see the part of the septum pellucidum is still here, but it's damaged because for this particular specimen, we are almost at the midline. So you can see the cavity of the lateral ventricle right there. So the space right here should be the third ventricle, and you can see there is there's a space right there, a canal. That's the cerebral aqueduct, or the aqueduct of Sylvius, which will bring CSF to the cavity of the fourth ventricle right here, no? Then the fourth ventricle has two openings, no? Two lateral openings, the foramina oblusca, and it has a medial opening, no, in this area. So that's the foramen of Magendie. So that will be the exit, no, points for CSF coming from the fourth ventricle, going towards the subarachnoid space, where CSF can circulate around the brain. And there's also CSF that will enter and fill up the central canal of the spinal cord, no, going down. So let me bring back the other specimen, because I can also show you substantia nigra, no? You can see the dark pigmented structure, no, right there. That's already part of the midbrain. It's not part of the diencephalon anymore. So this right here is the pons, no? So that should be the midbrain area right there.